Many of the restorations I do involve bonding of some sort. For instance, the use of sealants through fissures as opposed to extending the amalgam preparations through fissures. But if we're very near to the pulp, we need not to cause an exposure. There is no good reason to expose the pulp of a tooth that is normally vital and has had no history of spontaneous pain. We see a definite area of cavitation, telling us that a restoration needs to be done in this tooth. But what should that restoration look like? How extensive should the restoration be? I'd like for you to stare at the center of these squares. We see gray in the white area. We know that it's not there, but our eyes tell us that it is there. This is mock band effect. But it's also a phenomenon that we see radiographically. Why do fissure sealants fall off? First of all, if there is cavitation when we place the sealant, it can't be maintained. There is no support. There is no enamel support for the sealant. We should join the technologies of amalgam that we've had for years with the more recent technology of bonded resin. Advantages of this marriage include the ability of resin to bond to enamel and dentin. This photograph shows the proximal plate of enamel being fractured away using a spoon excavator. Now I'm going to use the back of a spoon excavator to burnish that matrix and to give it a bit of contour and to make sure that I can feel the adjacent tooth through the matrix. And here's our restoration without the probe in place, but you can see that if we put the probe from this tip to the tip of the second premolar, it would approximately touch the mesofacial cusp tip of the molar and go gingival to the distal facial cusp tip, similar to our preoperative registration. The matrix has been placed and it's been shaped to provide the contours that are desirable in our